as we go down, you kind of get a chance to see. Germany, the Netherlands, Japan, and Switzerland are essentially kind of like our employer-based insurance in the U.S. Coverage is private coverage, private doctors, private hospitals, and private insurance. There's no socialism there. If you go next to Canada and Taiwan, rely on private sector providers paid for by government insurance. It's kind of like our U.S. Medicare and Medicaid programs. And if you look at Britain, New Zealand, and Cuba, that's socialism. The government owns the means of production, sets the prices, in a way sets demand, mainly through the waiting list, and is able to control it that way. This kind of looks like our own armed forces, VA hospital, Indian Health Service, and federally qualified health centers. And finally, if you look at Burundi, Burma, and Cambodia, I hope you haven't needed health care there. That's all uninsured, both rich and poor. If you've got money, you get health care, and if you don't get health care. So those are a good balance of how the systems are broken out. In fact, we don't have one single system in the U.S. We've got a variety of systems, some of which the government does own the means of production, some of which are entirely private, some of which are totally capitalistic in the sense that if you got the money, you get the care. Very expensive plastic surgery, that kind of thing. The next slide. Under current healthcare in the U.S. and Colorado, where do we get our insurance? And I think this is important for you to kind of understand. If you look at the numbers on the inner side of the circle, you get a chance to see what the U.S. part is, and then over on the outer ring is where Colorado stands. Employer-based sponsored insurance, 54 nationally, 57% in Colorado. Public programs, Medicare, Medicaid, 26 nationally, 17% Colorado. Individual, 5%, 7% Colorado. Uninsured, 15% nationally, 17% Colorado. That kind of tells me that we're a younger state, and I think you see that in a lot of other healthcare issues. And also this uninsured part where it's a little higher is a problem. A younger population sometimes feels that they can live without insurance, and also not having insurance is a hallmark of the working poor. Just want to mention at the outer, on the far right side, 70% of uninsured are from working families. So you can see that this business of not providing health care insurance is going up. And also, 40% of the uninsured are the young invincibles that I mentioned. It is true in public health planning that young adults, about 18, 19 to 30, think they're going to live forever. And we all know that that's really not true. If you take another look on the next slide of our healthcare expenditures, it shows that in terms of our gross domestic product, we're spending a lot more than the other nations are. And you can see it as the government gets more and more in charge of healthcare, its impact on gross domestic product goes down. If you look down the bottom, United Kingdom, Japan, you can see the U.S. healthcare system is very, very expensive. When I first became a hospital administrator and got out of graduate school, the percentage of gross domestic product was about 8%. And you can see what it's gone up over the years. On the next slide, just to show you, it's another cut on the how expensive our system is. Our health expenditures per capita is simply just shows that we're spending a ton of dollars on health care. And then finally, the administrative costs in health care. We're spending a ton of dough on the administrative costs in health care. It's about 20% now. And those are a profit in some of the systems. They are the cost of paperwork in some of the systems and some of the insurance policies. It is profit in some ways. It's manager executive salaries in some ways. And you can see that this administrative cost business is very expensive, and it goes down with in those systems that are more managed.
And by the way, that's to pay stockholders too, right?
I'm sorry.
That's part of the stockholder payout, right?
Well, yes.
Excuse me, sir, could you speak a lot louder?
I'm sorry.
We can't hear you. Could you speak?
I'm sorry. Is that a little better? Let me see. Okay. Finally, in the Colorado context, you can see that the average premium for employee coverage in Colorado doubled during the decade between 96 and 06. And you can see the impact that has on employers and why some employers are giving up covering their employees. Colorado families spend about 19% of their income on health insurance in 2007. Between 2000 and 2007, health insurance premiums rose 4 times faster than wages. And my thoughts about that is how much longer can we stand the current system? I mean, that's a fact. I remember